What's up, you guys? Welcome back to my YouTube channel. My name is Siki. For today's video, we are going to talk about how to work out when you have bad knees. If you are someone who maybe you work out regularly, maybe you are an active person, like maybe you don't work out, but you're just like an active person, like you're constantly on your feet, your job is very active, but you are constantly in pain, like when it comes to your knees, you experience a lot of discomfort, sometimes you can't sleep because your knees are really bothering you, or maybe you are someone that avoids being active, maybe you're someone that avoids working out because you have bad knees, or because you are concerned about experiencing pain because you've experienced pain in the past, right? Or maybe you are someone who is obese or overweight like I was, and you experience a lot of knee pain after movement, or maybe you've gotten an injury in the past and it's because of the impact that your knees are dealing with. Before I get 100% started with this video, my 5-month-old daughter is right next to me. She's about to nap, so she's going to start snoring. So if you hear the snoring and if it becomes unbearable, I'll put her in her cage, but I don't want to do that. Anyways, so the first step is actually setting time aside purely for movement. That normally is a walk. You can also do some stretching, but I would suggest starting off by just getting your body upright, right? Getting yourself used to kind of bearing all of that weight. And I would say start with walks that are about 10 minutes long, 10 to 20 minutes long. If you're someone that doesn't work out, I wouldn't recommend you automatically, or someone that's not active, I wouldn't recommend you automatically start walking for like 45 minutes to an hour. That may be an added stressor to your joints, so just start off with like a small increment of time. You also want to start off with a smaller increment of time because it's easy to say, okay, at 7:30 when I wake up, I'm gonna go for a walk, right? It's easy to say at 7:30 p.m. when I get home from work, after I change out of my clothes, I'm gonna take a walk before I eat dinner, or I'm gonna take a walk after I eat dinner. But if you have to plan in 60 extra minutes, it's like, yo, like, you know, in the morning when you're getting ready, it's like, that's intimidating, right? So I would say start off with that increment of 10 to 20 minutes, okay? And if you're someone that maybe you are very sedentary, right? Start off with 5 minutes, right? 10 minutes may even be a bit intimidating. Start off with 5 minutes, or maybe you're very heavy, okay? Start off with 5 minutes. It doesn't have to be a super fast walk. It can just be a slow recovery pace walk. A good way to know if you're walking at a good rate is if you can have a conversation. So if someone was walking with you, y'all would be able to just talk and just kiki and chit chat the whole time. You don't want to be walking so fast that you're out of breath trying to catch your breath. You want this to kind of be just some time where you can kind of get into your body and actively recover and strengthen your knees and get some blood flowing to those muscles and tendons in a way that's more gentle. The second tip is to start introducing some form of rehab exercises. Take some time aside and just have a day where you just do not recovery, what's it called? Where you just do rehabilitation type of exercises, right? Those are exercises that are like lying leg extensions, not the kind you see at the gym, not the machine leg extension, but you're like lying on your back. I'm gonna do a video on exercises that I do to strengthen my knees. But you're gonna do an exercise like that. You want something for your hamstring. You want to kind of take some time, not just to strengthen the joint itself, but also to strengthen the muscles around the joint, okay? So you'll do the lying leg extension. That's really good for your quad. Maybe some calf raises, of course, for your calves. And then maybe a prone hamstring curl with a resistance band. And with these type of movements, go nice and slow. And you want to start with both of these tips, with both the walking and with the rehabilitation exercises. Start off with like a modest amount, and then over time, increase the amount of reps that you're doing, okay? I would say like over the course of 3 weeks, like 3 to 3 weeks, like 3 months. like 3 months, because then over time you won't need it as much. It won't have to be like an every other day type of thing. It can be something that you do for maintenance that's like 2 days a week. There are a number of different exercises, and I will make a video on exercises that I do to strengthen my knees. I have had 2 ruptured ACLs. Well, I have never had surgery, so I have 2 ruptured ACLs. I have 2 ruptured meniscus. I have a Baker cyst. I've lost cartilage in my knees. I've had my knees. Let me tell you something. My knees have been through a lot. My most recent knee injury was in 2018 when I passed out going down the stairs at the subway station and ruptured my ACL and my meniscus. So I am speaking from experience when it comes to these things. I never had surgery, and I work out pretty much, what, 4 or 5 times a week? Third tip. The third tip is going to be just start building muscle around that knee. So we all know in order to build muscle, we have to increase our load. The most efficient way to do that for most people is to just increase the weight that you're lifting. That does not mean that you immediately go from doing body weight leg extensions on your bedroom floor to grabbing a 225-pound weight, barbell and doing 3 sets of 10. No ma'am. No ma'am. What you want to start off with kettlebells, start off with dumbbells, and then of course gradually increase your weight. I normally increase the weight that I lift every 2 weeks. Yeah, and then I increase the sets every week. You want to start growing the muscles and building the muscles that are around that knee in order to support the knee. Not only will this help you on a physical level, this will help you on a mental level. As you see yourself moving more weight, you will have more confidence in what your body can do. So you're not going to be afraid of movement. And it doesn't have to be oh my gosh, I'm now a bodybuilder, I'm in the gym every day for 3-4 hours. No ma'am. If your goal is just to focus on getting your knees together, you only need to lift like 2-3 times a week. You don't have to lift like crazy. All you need is like a little sweet spot, and find like how you grow and give yourself time and patience, and you will see how you improve. There are so many exercises that you can do that will help you build muscle around that knee, and that will help you like with your confidence, that will help you with your day-to-day activities, right? Because if you have to go upstairs and you have bad knees, that's a point that's a stressor for you now. I remember how that was, where it's like, dang, oh my gosh, I have to go up all these stairs and I know I'm going to be sore because I have, bad knees, and you think that you're stuck like that, but you're actually not stuck. There are things that you can do that can strengthen your knees and that will help alleviate pain. My 4th tip is to consult a licensed professional. So if you are like me and maybe you don't have a lot of confidence in your doctor. I'm at a point now where I'm like, let me just get a new doctor, because the one I have, I'm like, sometimes I'm like, is there anything going on in there? Like, I know you're a doctor, so like you're supposed to be smart, but like every time I say anything to you, all you do is offer me Xanax or Lexapro. I have allergies, sir. Anyways, that's a different video. Anyways, if you don't have a lot of faith in your GP, I would definitely look at a physical therapist or a chiropractor. I go to a chiropractor and he is 10 out of 10. Would recommend. I am happy to say that I have the world's best chiropractor, and if you're in like South Florida and you reach out to me, you ask for his info, I will most certainly give it to you because he'll change your life. Seriously, I'm pain free. Seriously, and I spend a lot, I work with animals, I'm a vet tech. I work with animals and I'm constantly lifting dogs. Like, find a chiropractor, find a PT, a physical therapist, and they will help you. Unfortunately for most people, their GPs they're just the people that write them doctor's notes when they need it, or, write them a prescription or something. My 5th and final tip is to be patient and exercise wisdom when it comes to your body. So that means you give yourself time between the taking a 10-minute walk to actually starting a full-fledged workout split, right? That means that you give yourself time with the rehabilitation exercises to actually doing a box squat in the gym. That means that you give yourself time between, doing a box squat in the gym and doing a full squat of your body weight in the gym. And what that also means is maybe skipping the full body weight squat. I had to learn this. Like, I was so frustrated as to why I could not squat my body weight. I was like, I can lift all this weight, but I can't seem to just put 180 on my back and keep it moving. Why is that? So, but it caused so much discomfort for me. I work out alone. It's not like I have like a personal trainer yet. I'm looking for one. I'm on the hunt for one. Yeah, so I have to exercise some wisdom. I got to use some restraint when I'm in the gym, and I have to just focus on finding other squat variations. There are lots of knee dominant movements: squat, lunge, reverse lunge, goblet squat, beast stance squat. There are tons of different squat variations I can do in the meantime and in between time, but I have to be patient with myself, okay? So that's also a tip for me as well. And that's it for today's video. Guys, thank you so much for watching. Happy training. I hope that this helps. I also do plan on posting a video about the exercises that I do and about like a little gym type of exercises, like lifts that you can do that are knee friendly, and maybe even a knee friendly booty workout. I don't know. Actually, yeah, for sure. Actually, I'm doing that. Let me write that down. But that's all for today's video. Thank you so much for watching. I hope you enjoyed it. I hope it was helpful. Thanks so much for watching. See you in the next video. Bye.